In this video, we'll talk about the importance of blood glucose management in pre-diabetics. First, let us understand broadly what diabetes is and the internationally accepted classification of diabetes, pre-diabetes, and non-diabetes. First, let us briefly discuss about glucose, which is the source of energy for all physiological processes in the human anatomy. When we consume any carbohydrate, it gets broken down into glucose by various digestion processes in the human digestive system. Glucose is generated in this process, makes it to the bloodstream in the small intestines. Once blood glucose is detected, the brain signals pancreas to release insulin. As shown schematically in this slide, insulin is like the key which allows transport of glucose to the cells. In actuality, this involves various complex steps, including conversion of insulin to ATP and Krebs cycle, which refers to the process of release of energy from carbohydrates. We won't get into these details, but for now, it's enough to understand that glucose needs to get into the cells to provide energy to all cellular processes. This mechanism of glucose transport requires insulin. This process of glucose transport can run into problems in diabetics. As shown in this schematic, in type 1 diabetics, the beta cells which generate insulin can be destroyed by one's own body. These types of individuals are called type 1 diabetics. Type 1 diabetics need external source of insulin to get on with their lives. In type 2 diabetics, there is either not adequate insulin being secreted by pancreas. This could be due to dysfunction of beta cells or due to obesity, which causes cellular fat deposits. These fat deposits essentially make insulin very ineffective. Then there are gestational diabetics, which relates to development of type 2 diabetes during pregnancy. This normally tends to get reversed postpartum, that is after delivery. Typically, 90% of diabetics in the world are type 2 diabetics and 10% are type 1 diabetics. The classification of diabetes by WHO and American Diabetes Association are shown in this slide. There are 4 criteria for classifying someone as a type 2 diabetic by WHO and ADA. These are as follows. Number 1, the blood glucose level is greater than 125 milligrams per deciliter. Number 2, the postprandial blood glucose, that is 2 hours after consuming 75 grams of glucose, is more than 200 mg per deciliter. Number 3, the glycated hemoglobin or HbA1c is greater than 6.5%. And number 4, random blood glucose is greater than 200 mg per deciliter. Among the 4 classification criteria, HbA1c is typically used most extensively, as this is the most important metric since it is indicative of a 3-month blood glucose control. There is slight difference in pre-diabetic criteria between WHO and ADA. Per WHO guidelines, pre-diabetics are those whose fasting blood sugar is between 110 and 125 milligrams per deciliter, whereas ADA classification, this limit is set to 100 to 125 milligrams per deciliter. Now let us talk about incidence of pre-diabetes in the world. Firstly, pre-diabetics are those with slightly increased blood glucose levels, mainly from insulin resistance. They are in the borderline level and have a real and unique chance to delay the onset of the disease or, in the best case, avoid becoming a diabetic altogether. As per Centers of Disease Control, or CDC as it's known as, which is a US government agency, approximately 88 million American adults, that is more than 1 in 3, 33% of the US population has prediabetes. Of those with prediabetes, more than 50% don't know that they have it. Further, 70% of those people who are pre-diabetic will eventually develop diabetes in the long term. In India, recent publications in the Indian Journal of Medical Research indicates that 14% of Indian population is pre-diabetic. Some studies indicate that this is a gross underestimation of reality at ground level. However, in general, there are more diabetics and pre-diabetics in urban areas than rural areas, mainly due to lifestyle factors. Some studies also indicate prediabetes levels in urban areas exceed 20 to 25% of the Indian population. Another interesting statistic is about 10% of the pre-diabetics become diabetic every year. Year over year, they keep increasing. Now, here's a graph taken from a 2009 landmark publication where pre-diabetics were followed for over 13 years prior to the onset of the disease. You can see from the graphs the progressive increase in blood glucose levels as seen in fasting and postprandial blood glucose levels 5 to 6 years prior to onset of diabetes. This research also studied the health of pancreas as measured by the beta cell function and progressive decrease in insulin sensitivity, which is also measured in this study. You can see from this study that the progressive decrease in beta cell activity and insulin sensitivity starting in that 5 to 6 years starts to show up in increased fasting blood glucose and postprandials, and as they increase they finally get into a diabetic zone based on the criteria we discussed earlier. There are many factors that contribute towards this progression. Firstly, most pre-diabetics could be asymptomatic. This means they may not have any underlying symptoms. Poor nutrition, family history of diabetes, stress, and obesity could be the most important causative factors that slowly and progressively take over. So how do we take care of this progression and delay the progression or avoid the progression? Some studies have shown lifestyle interventions can contribute towards 40 to 70% reduction in risk. That is 40 to 70% reduction in risk factors in adults with prediabetes. So what are these interventions? Firstly, diet, exercise, and nutrition are the most important interventions. Secondly, in this age of fast-paced lifestyle and stress, one can derive significant benefits from our age-old traditions of yoga and meditation in terms of stress reduction. Of late, physicians are prescribing medications such as metformin to pre-diabetics to delay progression of onset of diabetes. This is possible actually if one already knows that they are pre-diabetic. Otherwise, what do you do? Let me speak from my own personal experience for a minute. I started this journey with diabetes and commenced metformin in 1990, where by pure chance I discovered I was moving towards diabetes. I was still a pre-diabetic then. This was a relatively new drug, metformin, during that time. By 2002 to 2004 timeframe, metformin started losing its effectiveness for me. I had to eventually take other drugs in addition to metformin to maintain target blood glucose parameters. My dosage started at 250 milligrams, it went up to 500 milligrams, then 500 milligrams twice a day, to 1000 milligrams twice a day, and then I reached the upper limit of the recommended use of this metformin, and additional drugs had to be supplemented. This is a common occurrence in people with diabetes, long-term diabetes. This phenomena essentially is believed to come from the dulling of the receptors that sense these active ingredients. As you continuously expose them to these molecules, it becomes dull and provide the needed efficacy. In case you're diagnosed pre-diabetic, or most people, and like most people, you have risk factors, you have to pay attention now with respect to your lifestyle and nutrition. So, first of all, do you have a family history of diabetes? Are you overweight? Are you obese? Do you have stress factors? You need to look at all these factors and start to look at ways to change your lifestyle factors. We believe here, Health Bliss Herbal Waters for blood glucose management is an excellent choice for you. It has many herbs and spices that work in unison to provide holistic glucose management. Each of these herbs and spices work in different ways to manage your blood sugars. We've covered the benefits of various herbs and spices in detail in a separate video, which you can review for more information. In terms of performance, our clinical studies have shown herbal waters for blood glucose management have shown substantial benefits in terms of fasting blood glucose, postprandial blood glucose, long-term blood glucose control, and in lipids control as well. As these herbal waters are made with 100% food grade herbs, there are no side effects. These waters have shown, as indicated, in lowering of various lipids parameters, that is cholesterol, LDL, VLDL, and triglycerides. They also provide antioxidant support, which help with overall health and wellness. So in conclusion, herbal waters provide an excellent wellness benefit for diabetics, pre-diabetics, and also for general population for their health and wellness. Remember, if you have been diagnosed as a pre-diabetic or have a family history or lifestyle factors, achieving good blood glucose control is best thing you can do for yourself to keep your blood sugars in check and delay progression of this disorder to become a full-blown diabetic. Even if you're diagnosed as a diabetic, it's really not a big deal. Maintaining a healthy lifestyle and regimen of good nutrition is not at all difficult. And then you can very easily manage diabetes. I'm a personal example. If you're a pre-diabetic, you really have a chance to do something now. We believe Health Bliss Herbal Waters can help you achieve your blood glucose management goals. Thank you.